Hello, my name is Trevor Greeley, and today I'm going to be talking about virtual reality in the healthcare system, specifically looking at revolutionizing physical rehabilitation. So, virtual reality is mainly used for gaming nowadays. That was like how it was first introduced to the broad consumer market. It's also used for like flight simulators and other things of that nature for training on different career paths. But what I'm going to be talking about today is the physical rehabilitation aspect of it and how it can help those people that need the help in drastic ways to get them back on track. VR based rehabilitation systems. So, VR rehabilitation leverages immersive environments for patient recovery. If you've never used a VR before, I have a VR. When you put it on, you just get fully immersed. The sounds, the visual, everything. So this helps the patient sort of get into that mindset of I'm here, this is what I'm doing, and help them to really focus in and work on their rehabilitation. Has real-time motion tracking, so as you move around the VR headset, they'll move around in there, which is really, really cool. Personalized therapy programs, interactive feedback, and gamification. The feedback just basically as they're working through it, instead of just being in the dark, not really knowing what they're doing, it's giving them feedback so that they know what they need to be doing and what they can change to get the most out of this program. And then remote monitoring for tele-rehabilitation. So basically people from a hospital can talk to a person that's at their house so they don't have to come in for all the appointments, and it makes it very easy for the patients to be able to use this kind of system. The cost. So we have initial setup costs on the right, or on the left, excuse me. The VR headset, it depends on what kind you get. Can range anywhere from $300 to $1,000. That's per headset. Then you have the motion sensors and accessories, anywhere from $500 to $5,000, just depending on how deep you need to go into it and what that specific patient requires. And then you have software development, which is $10,000 plus. There's tons and tons of software that they would need specifically for patients and to cater it to them. So they would have to build basically these little software systems to help the patients sort of get into those games and like just cater it to them and what their needs are. Software updates and maintenance is going over the ongoing costs. Software updates and maintenance, you have to continuously update software and then maintain the system and maintain the Oculus headsets and all that, like cleaning them and all that stuff, and then swapping them out if they get damaged. Staff training and patient support, so you would need specific staff, usually nurses. Nurses probably could apply for this job and get specified training. In that way that it's like a house call for nurses. It would be the similar situation where it's like an on-call nurse for this patient in the rehabilitation. And then subscription fees for applications if they use some of the games that maybe Oculus provides or something and they need to subscribe to something, that would be a cost as well. Fields of application, again, healthcare, stroke rehabilitation, post-surgery recovery, and neurological disorders. They put on that headset. Even though in real life they might not be able to move a body part, in the Oculus you can set it up to where they can move it and they can feel like they're moving it, and that can sometimes cause phantom sort of neurology in them to where they felt pain or they couldn't feel anything at all and they start feeling something, elderly care, balance training, and fall prevention. One of the biggest issues with the elderly, when they get older and older, their body starts to work against them. They fall down more. So this can help them sort of just center themselves, get into the VR, slowly work with it, slowly walking and figuring out how to keep themselves a little bit better balanced. And in sports medicine, injury prevention and rehabilitation, I mean, sports is probably one of the biggest places where injuries occur the most as far as they have to work very, very hard to get rehabilitated. Um, Not saying it doesn't happen outside of that, but sports, you see like ACL tears, meniscus tears, stuff like that. So this would be a huge help to those athletes who take like a couple weeks off after it happens and then slowly start working that muscle, rehabilitating that muscle. So those are the three main fields of application for this inside the healthcare systems. Potential improvement. I would say that if a hospital was serious about this and they really wanted to give it a good shot, they could work with one of the different VR headset companies and sort of get a better price, do a partnership, get mass production, and maybe work with some of the software developing companies and see if they'll be willing to help them out as well, and maybe just get a little bit better pricing, make it a little bit more affordable, because it is something that is going to help tons and tons of people. So that would be great. Accessibility, mobile device integration. So there are VR headsets where you can just you can take your phone and put it inside the headset and it would act the same as an Oculus. And maybe people that can't afford something a little more expensive like an Oculus that have a phone already, they could do something like that. My idea was that the healthcare system would provide this, and of course the people would have to pay for the service, so it would sort of counteract that cost. Just make it a little bit easier for the patients. AI integration, AI, people hate it, people love it. It's coming. There's no stopping it. AI is going to be instrumental here. And it's not like it's going to be taking over the world, taking people's jobs, but it would be huge for something like this to where AI could sort of program or change people's programs in such a way as the AI monitors and takes in that feedback from what the user is doing, just changes their program to slowly help them develop those skills little by little. Haptic feedback enhanced sensory stimulation, so just a little bit better of like basically diving into the Oculus, like getting those people a little bit more, as I would say, locked in to the Oculus there. And then user-friendly design. I remember helping my grandmother set up her phone for the first time, trying to get her to learn how to use her thumbprint to open the phone was quite a struggle. So definitely going with a user-friendly design here, especially for the elderly, because an Oculus, I mean, most of the elderly in today's age have never seen what VR is, don't know what VR is. They probably haven't really played any sort of video game mostly in their life. It's just the age we live in right now. So user-friendly design would be very, very huge. So in conclusion, I think that VR would definitely vastly help the healthcare system and with rehabilitation and working with people that just have that kind of need. And then also, I mean, it's future proof. There is so much growth that can be had in this field, and that would just make it the next best thing. It would make it extraordinary, and they could just keep building on top of it for years and years to come, which would be really cool to see where it all goes to. My source cited is the book we have for our class. Any questions? If you have questions, I know this is going to be a YouTube video, so you can drop them in the comments. I'll be more than happy to answer them. But yeah, I appreciate you guys listening to my presentation. I hope you guys have a great day.